I'm going to talk about a very important topic to both individuals and families, and also as a nation in general, because long-term care impacts all of us. So we have a problem paying for long-term care in Connecticut and in the rest of the country as well. And that's because of many misconceptions, misunderstandings, with the first misunderstanding being what long-term care is and what long-term care is not. So just to clarify things, long-term care is not health care. With health care, somebody falls down, breaks an arm or a leg, we end up in the hospital. You have doctors, nurses providing skilled care, and you have x-rays, MRIs, CAT scans. I've had the pleasure of having all of those at some point. With health care, we're trying to fix what's broken and send us home as quickly as possible. With long-term care, it's assistance with everyday activities, everything we take for granted: eating, dressing, walking, bathing, going to the bathroom. Or somebody may need long-term care because of a cognitive impairment such as Alzheimer's. So people need guidance or supervision, otherwise they are endangering themselves or possibly others. So most of long-term care is provided at home. That's where we all rather be. And then you have some of the other long-term care provided in nursing homes, assisted living, adult daycare. So long-term care can be provided in many settings. And someone who has long-term care insurance, it might be much more helpful to try to keep the person at home as long as possible so that they can be comfortable and have all their needs met. Now, another misconception is the risk of long-term care. We cannot guarantee that each and every one of us here will need long-term care, but we guarantee that we are all at risk, because reality is there are many car accidents, sports injuries, long-lasting disability, disease. We simply don't know what's around the corner, and about 40% of people need long-term care. They're under the age of 65. And if we live to age 65, close to 70% of us will need long-term care. And women are at greater risk. That's because you live longer. I tell my wife, she keeps forcing me to paint the deck and other things on the weekend instead of playing golf. My life expectancy is reduced, but she's not buying that, so I guess I'll be doing a lot of painting this summer, which is fine. But the point is, if statistics continue as they are, it's even more important for women to think about how to protect yourself should you need assistance because of a long-lasting disease or disability, and long-term care can be a pretty good solution for many people. Now, another misconception is the cost of long-term care. We have the dubious honor of being the second most expensive state in the country. And that's because where the cost of living is high, the cost of care is high as well. Feel free to yell it out. What other state could possibly be more expensive than Connecticut? California, that always is very popular, so people must think it's very expensive. Hawaii, that's a pretty good one. So I give you a hint. If you would like to see Russia on a clear day, then you'll be in Alaska, where glaciers may float by the window and you have beautiful views. And the average cost of care in Alaska is $750 a day. Now in Connecticut, thank goodness we're not there. Hopefully we'll never be there at $750. But the current cost is $407. That's the average. So many nursing homes are charging much more than $407. Could be $410, $500, $550. And there are a good number of nursing homes that also charge less than $400. It's interesting, all the states around us is where the most expensive care is experienced. So New York, New Jersey, Massachusetts, we have Connecticut, New Hampshire, then you have Hawaii, Alaska. Now California, the cost of living is pretty high, but for some reason the cost of care there is not as high as some of the more expensive states. Perhaps they have people we don't know about that provide care for less, that come from other parts of, who knows, the country or whatever. The point is, cost of care is a little bit lower in California. But if you go to Florida, Mississippi, South Carolina, Arizona, Texas, there are about 70% of the states where the cost of care is less than $300. So that may work well for some people, especially if you have relatives in that part of the country. All right, so if long-term care is so expensive, who's paying for it so far? Unfortunately, these are the people where they have to spend down their assets because they're paying for care, they don't have other resources, and then they become poor and end up qualifying for Medicaid, and I'll tell you how that works. Then you have more than 10 million people that have purchased long-term care policies or a combination of them. And then you have Medicaid program paying more than 60% of long-term care expenses. Now in Connecticut, in order to qualify for Medicaid, we have to be poor, and we spend down our assets as a single person to $1,600. So we spend down our assets to $1,600, then we're eligible to apply for Medicaid. That's as a single person. If you're married, the state doesn't want the community spouse to become poor as well because one of the spouses is going to the nursing home. So the community spouse gets to protect the house, regardless of value, the car, and then up to 50% of their assets, but no more than $119,220. So the house, the car, and then up to $119,220. And I can talk more about that if you have questions later. As you can see here, we do not talk about Medicare at all because Medicare is not designed to pay for long-term care. You may have heard of somebody who's gotten long-term care paid through Medicare. Those are situations where first you're hospitalized at least 3 days without counting the day of discharge. So somebody breaks a hip, he or she is in the hospital, they get the care they need, then they may need 15, 20 days of rehabilitation. So in the nursing home, doctor's orders, skilled care is required. In those instances, Medicare will pay for long-term care. But on average, for the nursing home, long-term care pays 25 days. So day 1 through 20, they pay in full. Day 21 through 100, you got to pay a deductible, which I think is about $162 a day these days. And then after 100 days, Medicare won't pay anymore for care that you may need. I just had a friend, and they hear me talk about this every now and then. She calls a week ago, and she says, my father is in the nursing home, and Medicare is not going to pay anymore, and they want $10,000 every month up front. And she's like shocked. And it's like, well, you weren't listening when I was explaining to you how the program works. If we need long-term care itself is very expensive. So if we have ways to prepare ourselves and transfer the risk to insurance, that might be a good way to protect our assets and taking care of our needs. Now, I hit on some issues already as why long-term care. The risk of needing care is very high. Also, the cost is very high, unfortunately. Even home care can be $60,000, $80,000, $100,000 a year. It depends how much care you need. If you need 7 days a week, 24 hours a day, and different services you may need. Medicare, health insurance, and the Affordable Care Act do not pay for long-term care. So some people may think it does, but then they have a bad surprise that these programs don't pay for long-term care. Now with Medicaid, it will pay for long-term care. It was designed to help pay for poor women and children's care, but now it has become the safety net for everybody who's turned down from Medicare or simply spends down assets. And eventually Medicaid won't be there for the people who truly need it if we keep going at this rate. So we need to find different solutions. Every day, not every month, not every year, every day, close to under 10,000 people turn 65. So the demographics are changing significantly. In 1945, we had 45 employees to 1 retiree. Today, we're lucky if we have close to 3 employees to 1 retiree. So we need a lot more younger people to get jobs, work, pay taxes, contribute to Social Security and everything else like we have. So hopefully when we need it, it will be there. And another reason why in Connecticut we think about the long-term care program is this special program called the Connecticut Partnership for Long-Term Care. Where I work at the Office of Policy Management, we oversee this program. Ultimately, the insurance department gets to approve which insurance companies can sell partnership policies after our review. And the insurance department also monitors these companies. So we work with the insurance department. We work with the area agencies on aging. We work with the Department on Social Services. And the idea is to try to bring a better program for Connecticut residents, and I'll tell you a little bit more how it works, so that we have better protection today and in the long run as well. So the state of Connecticut was very innovative and proactive. Back in 1992, introduced the first partnership program in the country. At that point, California, Indiana, and New York also introduced other programs. Somebody in Washington, D.C. did not like the idea that we were giving more breaks to the people who were on Medicaid, so he was successful in halting any future development of states with partnership programs, even though many states wanted to offer partnership programs. So luckily for us, in 2005, the Deficit Reduction Act removed these restrictions, and today it's no surprise to see 43 states in the country that have partnership programs, and we believe there will be a few more before everything is all said and done, and I'll tell you how that works. So the partnership program was created with 4 goals in mind. You see, if you purchase a non-partnership policy and you run out of insurance benefits and you still need 3-4 years of care, you are still at risk of spending your income and your assets, and you could become poor. So you bought insurance, you were hoping to protect your assets, but unfortunately it didn't turn out to be a real good decision for you. So the state asked the question, what can we do to help Connecticut residents who buy insurance and to guarantee that they will not run out of assets, at least a certain amount of assets, once the partnership policy has paid benefits. And I will show you how that works. If the state of Connecticut was going to enter into a partnership with insurance companies, we were going to raise the bar much higher in terms of the standards that insurance companies have to meet in order to be stamped approved as a company that can sell certified policies. And I'll tell you what these standards are. Also another goal, to provide public education. We've done a lot of free television and radio and a lot of libraries. Last year we talked to more than 1,000 people, about 60 presentations. We don't have a humongous budget that every week we can bother you on television like some of the other insurance companies are able to do. So we try to do the best that we can, but sometimes people are in tune, sometimes people are not listening. You know, yesterday we had about, I think it was 14 people at the Mansfield Library, and they asked a tremendous amount of questions, and the librarian there was saying, wow, it must be a good time because there was so much interest based on the questions that they were asking. So I'm seeing groups of 30, 18, 10, 14, 40. It depends on the location and the particular evening. One last goal here, just as important. There's a formula in place that since 1992, the partnership program has saved the state of Connecticut Medicaid program more than $23 million. And that's because more and more people have purchased partnership insurance policies, and then the insurance policies were more than enough coverage. Most of them did not run out of insurance benefits. So I'll explain to you how the partnership grows in value to try to keep track of inflation or stay ahead of it. And we'll talk about that shortly. So back in 1986, we were spending over $317 million to pay for long-term care through Medicaid. And the state estimated that by the year 2000, we would exceed $1 billion. But unfortunately, we exceeded $1 billion by 1996, and today we're at $2.89 billion. So what that means to us, that out of every dollar that we pay in taxes, 15 cents is used to pay for long-term care. And that 15 cents will continue to grow if we don't find better solutions. All right, this is just a sampling, and somebody earlier said it's not exactly the easiest insurance. It requires a good amount of conversation. These are some of the issues where we make a decision if we buy a policy. So for example, you're asked, do you want to have comprehensive coverage, which they will give you pretty much all the different options, assisted living, home care, nursing home, adult daycare, community-based services. 99% of partnership policyholders select comprehensive coverage. With the partnership, you can also purchase a plan that only pays for institutional care. So that's the nursing home and assisted living. Now that costs a lot less than comprehensive coverage, but the problem is, if you need care at home for a number of years, you don't have any coverage whatsoever. So we don't recommend the institutional-only plan. We recommend comprehensive coverage. And then you choose, do you want a daily benefit, meaning do you want the insurance company to pay up to a certain daily benefit like $300, $350, $400? So if you choose $350, that means that on each day you can spend in services whatever amount you want, but you will only be reimbursed up to your daily benefit. Let's say it's $350. So if you spend $300, the policy pays $300 for services. The extra $50 will stay in your pool of money, so you're not losing it. But if you have a daily benefit of $350 and you choose to spend $400 a day, or you need to spend $400 a day, then the extra $50, you got to pay for it out of your pocket. So with a daily cap, the insurance company will pay no more than that daily cap. Now, weekly or monthly, just the monthly example here, you may get a pool of money, let's say $10,000 a month. With a pool of money that is monthly, you can spend $300 on Monday, $400 on Tuesday, $500 on Wednesday. So in other words, there's no daily cap. The services you require, you're spending that pool of money. The only risk is if you spend it all after 20 days, then day 21 through 30, you don't have any insurance until the next month where the pool is renewed itself. So because you have access to a lot more money earlier with a monthly benefit, it costs a little bit extra. So therefore, most people choose a daily benefit. Now, you also choose by telling the insurance company how long you want them to pay for. And shortly, I will tell you a good approach on how to decide how much insurance to select. But you tell the insurance company, I want a plan that pays $300,000 or $200,000 or $500,000. Now keep in mind, the larger the pool, obviously the greater the premium that you have to pay. So somebody may say, well, I want to protect $600,000. So they ask the agent, show me how much the insurance costs for $600,000. And then they say, well, maybe I want to protect $400,000 because the cost of premium is too much for them at that level. So I'll give you different options to think about as we move along, and I'll give you more specifics. And inflation protection, this is very important, and that's something that the state spends significant energy in adding it to the partnership plan. All partnership policies have what's called 5% compounded automatic inflation protection, because the state wanted us to buy good policies that would keep up with true inflation instead of inflation being up here and your benefits are down here. So the goal is to try to buy a policy so you will not have too much out-of-pocket expenses. So all partnership policies include 5% compounded auto inflation, which means that somebody who buys a policy tomorrow, let's say it's $300 and a pool of money of $300,000. Each year, those amounts will grow by 5% compounded. $300 after 14 years will double to $600, and $300,000 after 14 years will double to $600,000. So somebody who has a $600,000 pool of money, that means their needs will be taken care of until $600,000 is exhausted. Shortly, I will also show you the extra value that partnership policies bring to the table, where before I told you, in order to qualify for Medicaid, we have to spend down our assets to $1,600 as a single person. What if there was a way that we can protect $300,000, $400,000, $500,000, and still have Medicaid pay for the care that we need, but protect all those assets that other people cannot if they don't have a partnership policy? And another decision you make is the elimination period or deductible period. This is the time between when you first need services and qualify for insurance benefits. So Initially, it may not be clear if somebody needs long-term care right away. They may be able to get through it and may not need long-term care in the future. So medical plans may pay some expenses. Medicare may pay some expenses. So if you choose a 90-day elimination or deductible period, during those 90 days, you are responsible to pay for any expenses if nobody else pays. Then after 90 days, then you are qualified for the insurance benefits, and benefits begin until the pool of money is exhausted, if you exhaust it. So I'm going to give you some quick information about the state endorsement of these policies. I'm going to explain Medicaid Asset Protection. This is the backbone of partnership policies. It's very, very valuable, and I'm going to give you some examples to show you how it works. I'll give you some examples of the consumer standards, and also we'll talk about the nursing facility discount that only Connecticut partnership policyholders can have if they receive care in a Connecticut nursing home. Right, so the state does not go out and look for insurance companies. They come to us, and then they submit their policies, their ratings, information about their programs, and we normally tell them this is what you need to change in order to be considered you're meeting partnership requirements. After they change their policies and they agree to pay benefits with the requirements that we have in place, we give them permission to file with the insurance department, and then the insurance department has the final word on saying they're approved or not approved. So an insurance company has to go through a thorough process and meet our requirements before they can sell partnership policies. All right, what is special about Medicaid Asset Protection? Medicaid Asset Protection is a very powerful and beneficial provision only available through partnership policies. So let's say that this side of the room has never heard of the partnership, meets with an insurance agent who is not certified to sell partnership policies, and you buy a policy that pays out $300,000. After 10 years, you file a claim with the insurance company. $300,000 of services have been paid. Your policy is exhausted. You have no more benefits. But unfortunately, you need 5 more years of care. So now you got to pay for that care out of your pocket. And that could be very expensive for some people, and unfortunately force them to spend their assets down to $1,600 and qualify for Medicaid. This side of the room heard about the partnership, and you decide to get a quote from an agent who is certified to sell partnership policies, and you buy $300,000. So they bought $300,000, you bought $300,000. Biggest difference is non-partnership and partnership. When you buy a partnership policy, you have, let's say, your daily benefit, your pool of money. You have those features I talked about, but you also have a special account that does not exist for the non-partnership policies. It does exist for partnership policies, and it's called Medicaid Asset Protection Account. Now, this Medicaid Asset Protection Account starts out as 0, and it will remain as 0 as long as you're not filing a claim. But the moment that you file a claim, and let's say after 1 month the insurance company pays $10,000, now your Medicaid Asset Protection account in your name has $10,000. This is not a bank account. We're not changing, money is not exchanging hands in any way. It's just a value that is growing based on how much the policy pays. So the more the policy pays, the more is the value of this account. Let's say $50,000, $50,000, $100,000, $100,000, $300,000, $300,000. So now the policy paid $300,000 for you as it did for them, except they had to pay for care out of their pocket, but you have $300,000 of Medicaid Asset Protection. Let's say you're all single, you apply to Medicaid, Medicaid says you have $300,000 of Medicaid Asset Protection. Therefore, you can protect $300,000 of your assets plus the $1,600 that everybody else can. So this side of the room, unfortunately, only has $1,600. This side of the room has $300,000 plus $1,600. And you both if you purchase the same level of coverage from the same insurance company, you did not pay one extra penny for having a partnership policy. So that's the main difference. By making the decision to purchase a partnership policy, you're able to protect a lot more of your assets that unfortunately other people who don't have a partnership policy cannot protect. This is Alice, Bob, Cindy, and Dave. And we have the assets that each person has. This column here is how much the policy, the partnership policy, paid or not. And then we have countable assets, which is how Medicaid sees this particular person's financial situation. Now, Alice is based on a real situation that happened years ago. Alice is a grandmother who has $100,000. She doesn't want to know anything about hiding assets, transferring assets, doing anything legal, creative. She just wants to protect $100,000 to transfer it to her daughter to help pay for the grandchildren's education. So she heard about the partnership, meets with an insurance agent who is certified to sell partnership policies, and the agent explains to Alice, Alice, if you want to protect $100,000, you have to purchase a policy that pays $100,000. So she bought a $100,000 policy. Now, I'm not throwing in here inflation right now to keep it simple. Unfortunately for her, 2 years later, she developed Alzheimer's, files a claim with the insurance company, they approve, and they start paying for the care that she needs up to the daily benefit amount that she selected. Let's say that after about a year and a half, all $100,000 of the policy was paid out. So she has $100,000 paid out, which is equal to $100,000 of Medicaid Asset Protection. She files a claim with Medicaid. Medicaid says, Alice, you're single and you have $100,000. You got to spend it down to $1,600 before you qualify for Medicaid. But Alice, the family, or somebody who has power of attorney, shows to Medicaid, which is also required, a report that insurance companies by state law have to mail every quarter, or they can get in trouble if they don't. Every quarter they have to send a quarterly Medicaid Asset Protection report to people who have filed a claim with the partnership policy, and they're filing it with the insurance companies. The report shows how much benefits have been paid, how much is remaining, how much Medicaid Asset Protection Alice has earned. So once she shows that to Medicaid, Medicaid says, well, you have earned the right to protect $100,000. You have $100,000. So from Medicaid's perspective, she has zero assets. She then immediately transfers $100,000 to her daughter. And she went on for 4 more years under Medicaid until, unfortunately, she passed away. So here's somebody with limited assets in some circles, not that much, perhaps. And she was able to protect $100,000 twice. First, when she needed care, insurance paid for her care, and she did not have to touch $100,000. Then she took $100,000 and gave it to her daughter. And therefore, she ended up almost having the equivalent of unlimited coverage because all of her care was taken care of. It worked out very well for her and the family. Now, Bob here, same situation, except Bob worked 2 jobs. He has $200,000 in assets. Met with an insurance agent who explained, you got to buy a policy that pays $200,000 in order to have $200,000 of asset protection. So Bob purchased the $200,000 policy, runs out of benefits, and he has protected $200,000 through Medicaid Asset Protection. Now, once you file with Medicaid, and you have declared the assets that you have, and they see which assets are protected, you can immediately transfer the assets, or you can keep them under your name, or if you're married, you can transfer them to your spouse's name, or you can transfer them to children or a religious organization, or you can spend it. You can do whatever you want. Now, every year, at redetermination, Medicaid will look at Bob's financial situation. If he kept $200,000 and it grows to $220,000, he can only protect $200,000. The extra $20,000 must be spent down. However, if Bob was married and he transferred $200,000 to his wife, at redetermination, Medicaid does not look at the community spouse assets. So if the $200,000 went up to $220,000, then no questions asked, because $200,000 is no longer under Bob's name. So it's advised to try to move the assets as quickly as you can if you're married and you want to put them under somebody else's name. Now, Cindy here is an example of the equity of the program. She has $1 million in assets, met with an insurance agent. She explained to Cindy that if you want to protect $1 million, you got to buy a policy that first pays $1 million. Because you see, even if you buy a policy at $1 million, you still have zero Medicaid asset protection. The zero starts to change only when the policy starts to pay. Now, another way to protect $1 million is, instead of buying $1 million up front, if somebody cannot afford it, let's say you can afford $500,000. When you buy a $500,000 policy with the 5% compounded auto inflation every year, the benefits are going up by 5% compounded, and after 14 years, that $500,000 will grow to $1 million of protection. So if 14 years later, Cindy files a claim and $1 million is paid on her behalf, now she has earned the right to protect $1 million in assets. Dave here is someone who decides not to do anything, so he has no coverage. If there's no coverage, there's no Medicaid asset protection. Or let's say, unfortunately for Dave, he met with an insurance agent who was not certified to sell partnership policies, and Dave didn't know anything about partnership policies. Therefore, he buys a non-partnership policy, $200,000. Non-partnership policies don't have any Medicaid asset protection. He files a claim, $200,000 is paid. He has zero Medicaid asset protection. Now he needs more care. He applies to Medicaid. Medicaid says, Dave, you have $200,000. You're single. You got to spend it down $1,600 before you will qualify for Medicaid. And so $200,000 would have to be spent down. Now, when you're on Medicaid, if you're single, not only do you spend down your assets to $1,600, and this is for nursing home, because for home care there are some other requirements as well. But your income, you also allowed to keep $60 a month out of your income, or if you are a war veteran, you get to keep $60 plus $90. Now, the community spouse's income is normally not touched, but there may be some instances where some of, let's say he's in the nursing home, she's at home, some of her income may be diverted to help pay for his care, and vice versa. If she needs $5,000 a month to live at home comfortably, and she only has $2,000, instead of spending all his income for his care, some of his income can be used to help pay for the community spouse who's living at home. All right, so as I mentioned, if you're considering a policy, non-partnership or partnership from the same insurance company, the Medicaid asset protection is free. Basically, the state is doing this for us, for those of us who are taking responsibility to prepare ourselves should we need long-term care in the future. So it doesn't cost an extra penny. The insurance company has nothing to do with this except keeping track of it, providing reports, and other requirements. And the next step here could be very valuable to some people. The state is required by the federal government to go after and recover the funds from the state for an individual who had nursing home paid through Medicaid. However, if those assets were protected through the partnership Medicaid asset protection, then the state will not recover those assets. So somebody could keep as much as $100,000, $200,000, maybe more. It depends on what was protected through the partnership. Now, many people ask, well, what happens when I move out of Connecticut if I move out of Connecticut? So this is where there's a concept called reciprocity that becomes very important. Let's keep two topics separate because they can get confusing. The first is your partnership policy or long-term care policy will pay anywhere in the country, okay? So it doesn't matter which states have partnership programs, that's not an issue. As long as you buy a partnership policy from Connecticut, you can move anywhere in the country, and once you file a claim with the insurance company, then they start paying benefits based on the policy that you have. So you don't have to be in Connecticut to take advantage of the policy. So let's say you're in Florida, you file a claim 10 years from now, the insurance company is paying benefits for you, and you're earning Medicaid asset protection. So after 3 years, you earned $300,000 of Medicaid asset protection in Florida. Now you run out of insurance benefits. So how do you take advantage of protecting your assets? This is where reciprocity comes in. There are, I mentioned, 43 states with partnership programs. Out of those 43, 42 have reciprocity with each other. The only state that doesn't have reciprocity is California. So today, Florida and Connecticut have reciprocity with each other. So if I am living in Florida, I run out of insurance benefits, I apply to Florida's Medicaid program, they have reciprocity with Connecticut, they will recognize the $300,000 of Medicaid Asset Protection I earned through the Connecticut partnership policy. So I go on Florida's Medicaid program and I protect $300,000 plus the minimum amount of assets that they require. So in Connecticut, you have to spend down your assets to $1,600. In Florida, they let you keep $2,000. Most states require $1,600, but Florida and a few other states let you keep $2,000. Now, let's say that I'm in the Florida Medicaid program, and 6 months later, Connecticut and Florida decide not to have reciprocity with each other because states have the right to change the reciprocity agreement by giving the federal government 60 days notice. So this is not guaranteed forever. So it's very important to know that it could change at some point in the future, and reciprocity is not important today, but it's important at the time when we run out of insurance benefits and we apply to that state's Medicaid program. So if I'm in the Medicaid program and the rules change, I will be grandfathered in as far as the Medicaid Asset Protection I earned. However, if 10 years from now, I file a claim with the insurance company, I run out of insurance benefits, I'm in Florida, and Florida and Connecticut don't have reciprocity with each other, at that point, my choice is to stay in Florida and pay for care out of my pocket, or move to a state that has reciprocity with Connecticut so I can protect my extra assets, or return to Connecticut and take advantage of Medicaid Asset Protection here. Now, the average length of stay in nursing homes in Connecticut and in the rest of the country is 2.5 years. And for home care, you're looking at about a little over 4 years, and about half of these people at home end up in a nursing home. The average for Alzheimer's is 8 years of care, or between 2 and 16. A friend of mine's mother had Alzheimer's, unfortunately, for 21 years. Then she passed away. They were fortunate that they had 4 daughters, 2 sons. The father didn't want to have anything to do with bringing her anywhere other than the home, so she stayed there all that time. In the last few years, he started to need help, so they hired somebody to help out, but everybody took turns, and it's an unfortunate situation. It's a terrible situation. And if we look at what the Alzheimer's Association says, every 66 seconds, somewhere in the country develops Alzheimer's. So this is something that we're all, unfortunately, whether family members or some of us, we may have to face in the future. So it's good to try to prepare for these types of situations. All right, so how do you determine how much daily benefit, how much pool of money should we buy? And that can be a very tough question, because typical insurance programs, they say to you, well, how long do you think you will live? How many years do you think you will need care? I mean, these questions are impossible to answer. So with the partnership, what we're saying is a single person or married, if you stand back and just say, okay, how much assets do I have? And what income will I be having? If you can look at that. And then say, you know, out of everything that I have, my wife and I, or one person, this is what I would like to protect. I would like to protect $300,000. Or somebody may say, we want to protect $400,000. So when you meet with an insurance agent, ask for a quote that has coverage for $300,000, has coverage for $400,000, a daily benefit of $300 or daily benefit of $350. The higher the daily benefit, the better, because if you don't use it, it stays with your pool of money. If you use it, hopefully you won't have any out-of-pocket expenses. So home care can cost $225, $250 a day. So somebody who may buy a $300 daily benefit, hopefully they never need to use the nursing home. $300 may go a very long way. And then keep in mind that many other states, the cost of care is much less than Connecticut. So somebody who knows for sure they're moving out of Connecticut, a rich plan over here may become way richer in some other plan, or a minimal benefit here like $300 in many other states will be on top of the expenses, giving us the most flexibility. Okay, wait a minute, I didn't say much about this. So all partnership policies must include a wide range of services. You have the nursing home, assisted living, community-based care, home care. The primary purpose is try to keep the person at home as much as possible. Physical therapy, respiratory therapy, speech therapy. One feature here, homemaker benefits, which includes light cleaning, meal preparation, grocery shopping, transportation. All partnership policies must allow the individual who qualifies for benefits, and you need to show you need help with 2 of the 6 activities of daily living, eating, dressing, walking, bathing, and so on. Or you need guidance or supervision. So if you need homemaker services, you'll get them through the partnership policy without other benefits required. But if you don't know, with a non-partnership policy, you may end up buying a policy that says, in order to get homemaker benefits, you first have to receive some other required services. So that could be a plus for some people who purchase the partnership policy. The other thing, too, is that when you're at home, a nurse or social worker is required to come and meet with you and look at the settings, look what type of care you need, what resources you have. And the nurse or social worker must develop a customized plan of care that shows how you can stay at home safely. It does not say only what the insurance policy would be paying. So if you would like, and this is optional, you can have the nurse or social worker coordinate services for you because they know what services are available in the area. And also, you can ask them to be monitor of the services being provided, and that's optional to you and the family. Now, the lowest daily benefit that you can purchase in Connecticut with the partnership is $256, which is probably rounded up to $260. Now, this is not what we're recommending. This is the lowest amount that you can buy with the partnership. And somebody may say, you know what? Higher amounts are not affordable to me, but I like the way this program works. I'm going to buy a benefit of $256 plus the home care. We always recommend to be at the same level, meaning $256 for nursing facility, $256 for home care. Although you're allowed to buy a smaller amount, we recommend to buy a higher daily benefit amount for home care. So if you need it, it will be there. Because if you buy a lower daily benefit, then you'll have a lot of out-of-pocket expense. So somebody who buys nursing facility benefit and home care, $260. If they never need a nursing home, then the $260 is keeping up with inflation at 5% compounded if that's the choice you select. Hopefully that will be more than enough. And if you move to another state, again, $260 will go much longer way than the second most expensive state in the country. And these minimums next year will be increased as well. So again, we recommend try to buy a higher daily benefit as much as you can and keep the home care benefit at the same level as the nursing facility benefit. Another requirement and standard here is that if somebody's income goes down and he or she cannot afford the premium down the road, then they have the option to ask the insurance company, instead of, for example, $300,000, can they reduce it to $250,000 or find some way to lower the premium so the person does not lose coverage. Now keep in mind the rates can change, okay? Rates are not guaranteed forever, so make sure you understand. There have been people, and once in a while they're in the room and they say to me, my rates, I've had it for 15 years, they never increased. And I tell them, don't tell anybody. Because reality is that rates have changed for many people. And this individual bought a policy at age 42, his wife at age 40, so they've had it for like, I don't know, 19 years. And he told me that his rates were increased 3 times. His rates were increased 3 times. But remember that in the end, he said it was the equivalent of as if the rates were increased under 3% every year, but his benefits have more than doubled. So he's getting, in his mind, so much more value than what the premiums have increased. So if the insurance companies can prove the claims from years ago are much higher than expected, who would have imagined the economy that would have been as bad as it has been at different times? So return on investment has been less than expected. Lapse assumptions were also off than what reality was. So the insurance company files a report with the insurance department, and if they can prove that their claims are much higher than expected and that they cannot maintain the level of reserves for future claims that the insurance department requires, then the rates have to increase. So in many instances, the insurance department says, okay, these are the claims in Connecticut, and these are your claims in the rest of the country for this series of policies. It is not warranted for you to have a rate increase, so they flat out reject it. In some cases, the insurance department says you're asking for 40%, but your report justifies an 18% rate increase. Or in some instances, the insurance department has just approved whatever rate increase was requested because they felt it was justified. Keep in mind that with health insurance, dental insurance, every year the insurance company sees how much claims they have, how much premium, and they adjust the premium. If they have losses, they try to charge more the following year, and so on. With long-term care, that's not really possible right now because we buy insurance thinking that 10, 15, 20 years down the road we may need it. Hopefully we'll never need it, but it's not the type of event where every year there's action and you can adjust the rates. Now, the more we complain with legislators, the better it gets for consumers. There's a law in place that says that if you get a 20% increase or higher, the insurance company has to divide it over at least 3 years. We're hoping that that will be changed to just come out and say rate increases will not be greater than 7% at any year. But that's not there yet. They're addressing it. Hopefully that will happen at some point. All right, so insurance agents come to Meriden and starting in August to Wallingford, because this way in Meriden we're paying some money, in Wallingford we're not, to use the facility. Sometimes insurance agents come from California, Texas, New York, New Jersey, Massachusetts, obviously Connecticut. They got to come to us. First, they take 8 continuing education credits online through a course that we have helped develop for the online vendor. And that's required. All insurance agents must go through the online course. There's an exam. They pass the exam. Then they come to us, and we do a 4-hour training right now in Meriden. And it's pretty intensive. We give them a lot of case studies, and it's to help them better understand how the partnership works. Only after the 2-step training can an insurance agent have a certificate, and he or she can start talking about partnership policies, because if they talk to you about the partnership and they're not certified and they give you wrong information, then they can get into a lot of trouble. So all partnership policy holders who receive care in Connecticut nursing facility, in a Connecticut nursing facility, they're entitled to 5% discount. In general, we don't have any problems. 5% may not sound like a lot, but it could be $7,000, $8,000, $10,000 savings for some people. Once in a blue moon, we'll get a son or a daughter that says, I get this correspondence that says I'm entitled to, or my mother is entitled to a 5% discount, but we're not seeing any discount. So I get on the phone with them. We call the nursing home. We talk to the business administration manager and say, remember those letters that we send you every December that explain there's something special about the partnership policies? And they just take out a check and pay the credit back for 7-8 months or whatever time is involved. So, but then if you go to Massachusetts or New York or somewhere else, you would not get a 5% discount. This is applicable only to Connecticut nursing homes. Now, people say, how long do I got to pay for? Well, how many of you have homeowners insurance or automobile insurance? I've been paying 40 years, whatever amount of time, right? And for the longest time, sometimes you never file a claim and you wonder, why do I pay for this? Well, you pay for it because in the unfortunate situation where an accident happens, then you don't have to pay a lot of money out of pocket. About, I think it was 4 or 5 years ago, we had all those nasty storms. In 3 seconds, that tree landed on top of our house. $16,000 of damage, and we were very happy that we had insurance. And most of all, we were right underneath where the tree fell down. I'll tell you, it wasn't pleasant, but we walked out of the house being grateful that we had insurance. And this is pretty much what long-term care is. You pay for the insurance, it's guaranteed renewable as long as you pay premium. They cannot cancel coverage for you. There are some policies, if you find them out there, non-partnership policies, they're called paid-up options. We don't have those anymore. But paid-up options, you either pay a whole amount all at once, then you never have to pay premium again. It could be $30,000, $40,000, depends. The good thing about paid-up is that if rates change, then they won't impact you because you already pay for it, so you're all done. But it's not a partnership policy. And I mentioned that when you're in claim, there's a waiver of premium in Connecticut. We have a law that says insurance companies cannot require for you to pay premium longer than 100 days after you qualify for benefits. But ask your insurance agent, when do they waive premium? Some of them waive premium right away, or some of them may say you need 30 days of home care before then you no longer pay any premium. So you're not paying any premium, and your benefits are increasing with the automatic inflation protection as it applies. Now, these are some of the plan designs that impact your rates. Obviously, I said age, daily benefit, the pool of money, elimination period. Do not add any more additional riders to long-term care, like somebody may like a death benefit. So if I die, 100% of my premium goes to a beneficiary if I haven't filed a claim. And that sounds great, but all along I'm paying 40% higher premium to have that kind of benefit. So we recommend buy life insurance for that purpose, save and keep long-term care for long-term care so you don't pay as much. Obviously, some insurance companies may look at diabetes, it's control high blood pressure, even somebody who had cancer. It depends on the person's lifestyle. You can have a 10-minute conversation with an underwriter, call that 800 number there and say, I have some questions. Do you guys accept a person who has these factors? And they may tell you, well, we got to look at the whole thing. Or they may say no, because if somebody has Parkinson's, MS, dementia, somebody says, I have trouble getting out of bed. Everything is fine, but I can't tie my shoes, I can't put my pants on. Well, that's a red flag for the insurance company that there may be other issues at play. So about 15% of people may not get approved. Always ask the insurance agent for discounts. You know, some insurance companies may give you a 30% discount if you apply as a couple. So both husband and wife apply, and you both get approved, it's a 30% discount. If only one person gets approved, it could be a 15% discount. So ask if there are any discounts. So we're at the library here. This is a great place. We can do all the research we want for months and a long, long time. But reality is, who knows where things will be 10, 15, 20 years down the road. So if we choose an insurance company we're comfortable with or somebody's recommending, see what the cost is and see if it works for you. And that would be a pretty good complement to your overall financial protection, because we work hard to protect the house, the car, with house insurance, car insurance, but we don't protect it should somebody need long-term care in the future, where all of these assets are pretty much at risk if they are not protected. So if you have a friend or family member that would like to have a copy of the packet that you have in front of you, they can call the 800 number here. Also, all the information you have in front of you is right here with the ConnecticutPartnership.org website. Also, you can ask a friend to check this out, because there's a video we just added with questions and answers. It's about 30 minutes, but if they want to go through it, it's pretty good information which may raise other questions. And having said that, thank you for having me here.